Welcome everyone, and thank you for those joining us live and also to those listening in afterwards. I would also like to warmly welcome our guests who I will introduce during the course of the session. My name is Zuzana Kusinova. I am the lead for policy, practice and compliance at the International Pharmaceutical Federation. We are pleased to be delivering this event as part of the World Pharmacy Week special events at FIP Virtual. So welcome everyone. I will start with the short overview of house rules. Next slide, please. Please note this event will be recorded and it will be available at fip.org at our website. To those listening, please feel free to send your questions through the Q&A box and we will be picking up those throughout today's session. You are also welcome to provide any feedback to us at our email address, webinars@fip.org. And if you would like to become a member of FIP, you can find more information on our website under FIP membership. Next slide, please. So today we will be talking about the fight against antimicrobial resistance. AMR was a priority for FIP for many years. And now we are building on all work that has been done up to date. And FIP Bureau has set up the FIP Commission on Antimicrobial Resistance to further develop what pharmacy has to offer in AMR fight. Also, we would like to explore any opportunities to increase the impact across all settings and scope of practice. The Commission will also drive the new AMR Pharmacy Roadmap, which will guide actions globally, sustaining momentum and tracking and evaluating progress of this global health priority for pharmacy. And the Commission will also focus on the implementation of the AMR-specific FIP Development Goal that we will look into today, that looks at the role of pharmacists, pharmaceutical scientists, and pharmaceutical educators in reducing AMR. Next slide, please. So throughout the session, we will hear about the antimicrobial resistance through a message that we prepared for you. And after that, our CEO, Dr. Dagan, will talk about the FIP development goals that were launched earlier this week. We will then look into the special goal we have around antimicrobial stewardship, and we will launch the commission on AMR. We will then have the panel discussion with our guests today, and this will also be an opportunity for you to interact with the panelists. We have a representation from around the globe, so it will be very interesting discussion, and we look forward to receiving your questions. Please use the Q&A box for this purpose. And then we will look at the conclusion of the session and also look at the next steps. Next slide, please. So now you can hear the messages about the importance of action against antimicrobial resistance from various speakers, very high-level speakers around the globe. Thank you.
Working together is the only way to avoid the huge human, social, economic, and environmental costs of antimicrobial resistance. WHO continues to strengthen work with our partners. Addressing antimicrobial resistance is a key priority for WHO. I look forward to continuing working with all of you to combat this threat to global health and development. I thank you.
Unless urgent action is taken, the number of people affected will increase, with projections showing AMR could overtake some of the most significant causes of mortality by 2050. Among other contributing factors, too often antibiotics are used to treat viral infections such as cold or flu. Too often they are used inappropriately in the production of food. And too often Inadequate wastewater treatment results in antibiotic residue entering the environment, causing involuntary consumption and heightening resistance. This needs to change.
Then there are things that can be done in terms of rational use of antibiotics. For example, we know that a number of interventions are not just effective, but they are cost effective. So there can be incentives which are given to professionals. There can be communication campaign, leveraging the information, leveraging the incentive structures, so that these things are put in place into countries. And there is an absolute fundamental need to ensure that there is access also to antimicrobials. So working on the P side, on the price side of the price and volumes equation, if you want, to make sure that prices are affordable to everybody, regardless of where they live and regardless of their income. And there can be obviously things in terms also of stewardship programs, which can be coupled also with financial incentives which are given to professionals. So there is a whole lot of different actions that can be done. It's a matter of becoming much more granular. It's a matter of also of sharing best practices much more. What works in one country can be also imported and used in some other countries.
Working together is the only way to avoid the huge human, social,
in the production of food.
So there can be incentives which are given to professionals. There can be communication campaign, leveraging the information, leveraging the incentive structures, so that these things are put in place into countries. And there is an absolute fundamental need to ensure that there is access also to antimicrobials. So working on the P side, on the price side of the price and volumes equation, if you want, to make sure that prices are affordable to everybody, regardless of where they live and regardless of their income. And there can be obviously things in terms also of stewardship programs, which can be coupled also with financial incentives which are given to professionals. So there is a whole lot of different actions that can be done. It's a matter of becoming much more granular. It's a matter of also of sharing best practices much more. What works in one country can be also imported and used in some other countries.
Thank you for the opportunity to speak on behalf of the International Pharmaceutical Federation, the global organization representing 3 million pharmacists worldwide. We would like to applaud the WHO for its leadership in the activities towards the implementation of the Global Action Plan on Antimicrobial Resistance. AMR is one of the priorities of FIP's work, especially the responsible use of antimicrobial medicines. It remains key, as despite even if being able to discover the next generation of antibiotics, their efficiency may soon become impaired if used irresponsibly. Moreover, estimated $54 billion could be saved annually through responsible use of antimicrobials, and pharmacists have been identified as the main levers. FIP was pleased to contribute to WHO consultations to develop this global action plan. We are keen to collaborate on its implementation. FIP was recently invited by WHO to work on the engagement of pharmacists in collaboration with other healthcare professionals in reduction of AMR. In 2015, FIP launched a report called Fighting Antimicrobial Resistance, the Contribution of Pharmacists. It's available on our website at fip.org/publications, highlighting the best practices worldwide and how current national AMR policies are facilitated by professional organizations of pharmacists. It also summarized the best practices by a national pharmacist organization, for example, the early diagnostics of tuberculosis infection and referral by pharmacists involved in directly observed treatments, short course DOTS program in India, Pakistan, and Philippines. In preparing your national plan that needs to be adopted by 2017 according to the last resolution, WHA, such evidence could inspire and help you in reducing AMR, thanks to the use of the full potential of pharmacists. Thank you.
Number 1, education. It's cough and cold season right now, but no amount of antibiotics are really going to get rid of that cold. Fluids, rest, and over-the-counter pain medication are the way to go. If your patients need a prescription for antibiotics, then make sure you talk to them about whether they really need to finish the entire course or not. Sometimes they don't, and recent studies suggest that shorter courses are smarter. And remember, you can use best practice evidence and guidelines to talk to prescribers and patients about choosing the right antibiotics for the right patient. Over 90% of antibiotics are prescribed in the community. Pharmacists can help educate prescribers and patients on using them wisely. Number 2, health promotion and prevention. So pharmacists give flu shots, so we're already involved in programs around immunizing against viruses and even some bacteria. So use those opportunities to talk to your patients about the appropriate use of antibiotics and even remind them of the really simple things they can do to control and prevent infections, like thorough hand washing. Number 3, appropriate prescribing. In some provinces, pharmacists can prescribe antibiotics independently for strep throat and for urinary tract infections, which, by the way, is the 5th most common reason for emergency department visits. In many settings, pharmacists work with other healthcare practitioners and have a direct role in influencing the type of antibiotic that's chosen for a patient. And hot off the press from CPJ's June issue, there's evidence showing that when pharmacists prescribe for uncomplicated UTIs, symptoms are resolved in 90% of patients, and they can access a pharmacist's care on average a day earlier than their physician. And number 4, continue to develop those great relationships that you have with the physicians that you work with. Pharmacists can engage with prescribers to help influence or even change some of the antibiotic decisions that they've made for patients during prescribing. And as we get a more comprehensive electronic health record in this country, pharmacists will have even more information to guide the right decisions towards the right antibiotics for the right patient. And there you have it, folks. 4 things pharmacists can do right now to help fight this global health crisis.
Thank you for the video. And now I would like to invite our CEO, Dr. Catherine Duggan, to tell us more about the FIP development goals and the decade ahead and all the plans that we have in FIP. Catherine, floor is yours.
Thank you, Susanna, and thank you for that video, which highlights not only the importance on a global level of the issue we face, but also how pharmacy has contributed to that over the years. It's super important. Next slide, please. So I wanted to just take a moment to remind you of the FIP vision, which is a world where everyone benefits from access to safe, effective medicines and pharmaceutical care, never more important than during this COVID pandemic. Next slide, please. And our mission is to improve global health by supporting the advancement of practice, science and education. Indeed, this week, World Pharmacy Week, we are transforming global health. So all of our work streams align with global health priorities and align with our internal priorities. Next, please. So just stepping back a couple of years, I can't actually believe that this is nearly 2 years ago now. We attended the Astana Declaration, the reaffirmation of the world towards primary healthcare. And FIP stood up and stepped up in terms of pharmacy and made sure that we were front and centre, because we believe that pharmacists who practice at the hearts of the world's communities make a huge contribution to primary care. I think we've all seen evidence of that during this pandemic, as our profession has kept the doors open to access to safe and effective medicines and also advice. Next, please. Again, Susanna played the video earlier on, which outlined how aligned we are with global priorities. And we see here 17 Sustainable Development Goals, which outline the decade ahead. And we know that we've fallen back on some of these, especially during this COVID pandemic. It was really important for FIP to align ourselves to these goals, but to develop relevant goals for our own profession so that we can ensure we play our part globally, but also we support our pharmacists and our pharmacy teams wherever they are in this endeavour. Next, please. Alignment has been key over the past years, making sure that when WHO has issued a robust evidence around the health worker shortages, that FIP has responded in kind with workforce initiatives, workforce goals, and workforce plans, including workforce transformation. Next, please. Indeed, we've been on a journey with this. In 2016, the 13 pharmaceutical workforce development goals were published at a Nanjing conference. Then in 2017, a vision document highlighted where those goals were headed. In 2018, FIP commissioned the setup of the Workforce Development Hub, whereby colleagues gathered together and took forward those goals with development plans and transformation plans. In 2019, at our first regional conference in Amman in Jordan, we signed a memorandum of understanding with our Jordanian Pharmacist Association on a workforce transformation program. And this year, we have just launched on day one of World Pharmacy Week on Monday, the 21 FIP development goals, which really unite science, practice, education, and workforce under one set of goals, with elements of each reflected in each of those goals, building on the workforce development goals from 2016. Our vision here is that we cannot have pharmaceutical care without a pharmaceutical workforce. But as importantly, we cannot have pharmaceutical care delivery without a scientific foundation for the next decade. So it's really important for us to align and consolidate those three elements that underpin our professional organisations and our profession indeed under one umbrella. Next, please. So I just wanted to take you back to the launch. We have a little video that we'd like to play you that shows you the 21 development goals. And then we will focus on goal number 17, antimicrobial stewardship. Thank you. Next slide, please.
Thank you, Catherine, for your very informative presentation about the overview of the FIP development goals. And now I will talk more about the specific goal we have on antimicrobial stewardship. So we have 21 goals, as Catherine mentioned, and the goal number 17 is dedicated to antimicrobial stewardship, but also antimicrobial resistance in a broader term. Some of these goals are also related to AMR because they talk about the quality assurance or competency development or pharmacy intelligence. So all of these goals can contribute to AMR to some extent. But we will look into the number 17, which is a specific goal. Next slide, please. Next slide. So each of the goals has a specific element, as we call it. It's a workforce, practice, or science element. And if we look into the one that is focused on the workforce, it talks about the strategies and systems in place to develop a pharmaceutical workforce so that it's prepared to deliver quality services for antimicrobial stewardship. So this is the goal itself, that we look into the needs that we have. And we were also looking into how can we develop the mechanisms that help us to achieve this goal, in fact. So the first mechanism that we identified is to enable the workforce to acquire knowledge and skills necessary in initial education. This is also linked to the FIP Development Goal number 1, which is the academic capacity, but also the early career training, which is number 2, and also continuing professional development, which is the FIP Development Goal number 9. You have also the goals listed below in the table. And the second mechanism we identified was that we really need the competencies. We need to have competencies in place so that pharmacists are able to perform the antimicrobial stewardship services and also deliver them and incorporate them in competency frameworks and advanced specialist development. And this one is also in line with the FIP Development Goal number 4, which is the advanced and specialized development, and number 5, which is the competency development. Next slide, please. When we look at the practice elements of the goals, this one really talks about the infrastructure and frameworks that need to be in place to deliver the services for antimicrobial stewardship. So the mechanisms for this particular goal is to develop and implement systems and structures to deliver the antimicrobial stewardship services as coordinated program that helps to promote the appropriate use of antibiotics or other antimicrobials, but also to improve patient outcomes and decrease the spread of infections caused by multi-drug resistant organisms. Another mechanism that could help achieve this goal is to utilize and assess data and metrics so that we improve and optimize the antimicrobial stewardship programs. And of course, it's very important to continue advocating and also to support the responsible use of antimicrobials. When we look at the next slide, it's talking about the scientific approach or scientific element. And here we would like to promote the research and development of new antimicrobials, that we know that it's very important, but also the new antimicrobial combinations or new techniques to evaluate the impact of antimicrobial stewardship programs. And the mechanisms that really help or could help us to achieve this goal is to keep on promoting strategies that are mitigating antimicrobial resistance in community and hospital-acquired infections, but also the use of antibiotics in livestock production and agriculture. We also need to have a mechanism to report the research data that are underlying the relevance and impact of antimicrobial stewardship programs, because there are some programs in place, but we really need to look into the data and the impact that these programs are really bringing. And as the last mechanism that we listed is to raise awareness of powerful pharmaceutical sciences technologies, such as bioinformatics and quantitative systems pharmacology, to identify new combinatorial therapies. So this is again looking into the research, but from a different point of view. So here you go. These are the practice, science, and education or workforce elements of this goal. And of course, we are not limited to these mechanisms. We are not limited to the goals as they are written at the moment. But these are the aspirational objectives that we have ahead of us to achieve in the upcoming years. Next slide, please. So the goal really serves the objective of having a goal that transforms pharmacy globally. We are looking at the fundamental categories that are the elements that I mentioned, the practice, science, and workforce. And these are underpinned by the mechanisms that really are the tools or the structures to facilitate and support the process of pharmacy transformation. And what we would like to do next is to start developing the indicators that will help us measure and monitor the progress of the FIP development goals. And you may have attended also our previous session on AMR. We had the global workshop, and we also had dedicated regional workshops where we launched what we call roadmap on AMR, on antimicrobial resistance, that will be driving the action on AMR in the new decade. So we would like to go on the road where we would like to do specific activities that help us start achieving some of the goals that we outlined. Next slide, please. And now I would like to give the floor back to our CEO, Dr. Catherine Duggan, to talk about the Commission on Antimicrobial Resistance and also launch it officially. The floor is yours, Catherine.
Thank you so much, Susanna. So, colleagues, you see with the 21 goals in the circle that had been shown earlier on, that each is dependent and related to each other. So through the Commission, we can deliver not just the development goal globally, but through these regional roadmaps, really set some priorities. Susanna has said it, I just want to state it again very clearly, that AMR and antimicrobial stewardship is a priority for FIP and the world. The policy was updated in 2018. Globally, pharmacy is seen as a cause of AMR through inappropriate access and substandard quality, which is very sobering to think of, but also a solution through the development of new antimicrobials and diagnostics and evidence-based stewardship. And this is really what we're talking about today. It's how can we demonstrate solutions for resistance through good stewardship. Next slide, please. The idea of a commission is that we would bring together experts and expertise from within the FIP membership to exchange views on current activities, to really set the ship going on the right track, identify problem areas, but also best practices so we have solutions. And there was one of our colleagues in the video made mention that you can adopt and adapt. It's very much a FIP policy that we don't, we share and we support colleagues from one country with evidence from another. And that we work together on joint projects and bring some synergies to the piece. The Commission's duration will not be limited to a set time because we really need this work to be supported and championed as far as it needs. Next, please. So we wanted to set out today with you, and the panel will walk you through some of these elements in a little bit more detail, the scope of the Commission on fighting AMR. And we believe that it should encompass, maybe not be limited to, but should definitely encompass AMR, stewardship and education, research and development of new antimicrobials, environmental impact of antibiotics, and that fits very neatly with our sustainable goal, infection prevention and control, and responsible use of medical products. And that also, all of these are circular because it's not just what we do as a profession, but it's how we communicate that to patients and the public. We should be inclusive, and we should be pertinent to pharmacy practice, education and research across all settings. And if we set ourselves these principles, I think the Commission will hold itself in good stead. Next, please. We have quite a lot of objectives. And of course, the key here will be to outline the objectives and then to prioritise them alongside the work that was done last week with those regional roadmaps. We will not do this top down. This has to be done in a concerted, collaborative way. So the AMR Commission will establish a steering committee. We want to have diverse representation and expertise from the different regions. And we want to identify key work streams, really to prioritise what's needed and prioritise them regionally so that everybody has something relevant going on for the needs of their populations. We want to provide ad hoc technical expertise in AMR for our collaborations with partners. We want to provide guidance for FIP members on AMR in a variety of ways, whether they be virtual events all the way through to publications, all the way through to toolkits. And we want to have a research agenda specific to pharmacy to mitigate AMR, one that pulls practice, science and workforce development together. Next, please. Then we also want to develop focused education and learning, but not just develop it ourselves as FIP, but really showcase good education that is available from other quality providers. We want to develop advocacy, policy and practice toolkits and interventions. We've learned how these have worked for vaccination, and we can help in many ways regionally and globally with that. We want to deliver a programme of AMR and AMS events during the World Antibiotic Awareness Week, and also make sure that all of our events programme is populated very highly with regional engagement and AMR, AMS events themselves. And that will be through an annual events plan. Next, please. So the membership of the Commission, well, we know through experience, all of us have had experience, that the Commission needs to be lean to be able to deliver. Otherwise it'll be a discussion forum. So we need to make sure it has the optimum number of people for that, and then seek ways in which we can enhance and increase engagement and discussion forums, maybe through reference groups or working groups or through our regional forums, and we'll come on to that a little bit later. And our regional forums are going through a process of integration, more integration with FIPs. So this is a real good project for us all to get our teeth into, and I think this will be a really good opportunity for us to make sure the forums provide us with a regional platform. Next, please. We want to make the Commission up with people of expertise and interest, and whilst we've said we want to scour the FIP membership for that, that may include colleagues that aren't from FIP, and then we can cascade the work streams through our working groups and reference groups. The Commission can also be consulted when it's needed by the Bureau or by member organisations if certain priority areas come up that we haven't identified in our work plans. And it will be led by a chair that will come from the FIP Bureau. And the Bureau itself then will be informed and in communication with the Commission constantly. And this is a good way of working in FIP, where we try and link as many people together in the most appropriate, effective and impactful ways. We would recommend that the Commission members are free to propose a working group. Next, please. And that the membership of the Commission would be something between 12 and 15 people, with a chair, some regional forum, AMR representatives, members from the GRIP, we have the panel here today, so that we can really focus on the work, and then the actual work of the Commission takes place through working groups and regional engagement. Next, please. I've mentioned already, we really want to work with our FIP regional forums. We would see that every forum would be taking an ownership of the roadmaps that emerged from last week's engagement events, and through engagement events with our regional forums we could enact and support each of our member organisations within the region. Each region will have their roadmap, will have ownership, and will be able then to deliver with and through FIP as well as through the member organisations. Next, please. The chair I mentioned earlier will come from the FIP Bureau, will oversee and chair the Commission and make sure that Bureau is informed of everything. And then we can also have showcase events from the Commission and our regions as well. And we would see that the regional forums would have good communication and engagement through presidents and also AMR representatives. Last week taught us a lot. We have a lot of regional engagement opportunities, but also regional engagement with the AMR experts across those countries. Next, please. A working group can be set up, for example, on a particular area of work, maybe education or maybe guidance or maybe an advocacy toolkit, for example. And they can be selected and appointed by FIP leadership, and we've got good examples of working groups around statements and policy guidance documents as well. And it would be really good that the FIP Bureau supports the working group as opposed to fully appoints. I do apologise for that word there. Next slide, please. So the next steps, before I hand over to the panel, I think it's really important that everybody feels confident that there will be a call for nominations to come out in October. And can you believe it's October already? And then that starts the Q4 work, which really is setting up the priorities from the roadmaps that we've developed in September into a plan for 2021 and beyond against the FIP development goals. We'll seek nominations for a set number and sets of expertise and experience, and then there'll be room for regional engagement and involvement as we move forward with the integration map for the regional forums. We seek to have membership of the Commission finalised by the end of November, and we would like that the first AMR Commission will have their first meeting, by the end of the year. I think this is a really good ambitious target because we have the roadmaps from last week, we have the imperative documents, we have the Bureau support for a commission in this area, and now we need to be very practical and purposeful and deliver this. And in parallel, a chair will be selected by the Bureau and both things will meet before the first Commission meeting at the end of the year. Let's hope we get there. We do know that some things can step in our way and change our plans, but we endeavour to use this as the timeline and the time plan. Next, please. And in this way, I think we can start to realise some of the practical applications regionally and the practical applications nationally through our global development goal and our regional roadmaps. Thank you.
Thank you very much, Catherine, for this very informative presentation about the Commission. Next slide, please. We would like to now welcome our first panelist, Professor Sabiha Essek. She is the South African Research Chair in Antimicrobial Resistance and One Health, and she is also the Professor in Pharmaceutical Sciences at the University of KwaZulu-Natal in Durban, South Africa. She is the Senior Implementation Research Advisor at the International Center for Antimicrobial Resistance Solution in Denmark and serves as expert consultant on antimicrobial resistance and antimicrobial stewardship to the World Health Organization and its regional offices. Professor Essek is chairperson of the Global Respiratory Infection Partnerships and serves on the advisory board of the Combating Antimicrobial Resistance Bacterial Biopharmaceutical Accelerator, the Fleming Fund Expert Advisory Group, the Market Analysis Expert Advisory Group of the Global AMR Research and Development Hub, convened by the German government, and is also the member of the Wellcome Trust Surveillance and Epidemiology of Drug Resistance Infections Consortium. She previously served on the South African Ministerial Advisory Committee on AMR, the International Pharmaceutical Federation Working Group on AMR. She also contributed to our policy statement. She wrote the South African chapter of the Global Antimicrobial Resistance Partnership and the South African Antibiotic Stewardship Program. Sabiha, welcome to the panel.
Thank you.
We would like to ask you a few questions about the Commission itself, but also about the antimicrobial resistance. And we also have the possibility to interact with the audience. We already received some questions, so I will be asking them throughout the panel discussion to you and also to the other panelists. But just to start the conversation, the panel was instrumental in initiating the AMR Commission, so you were very active in this. But what was your motivation behind this, and what was the overall motivation behind initiating this FIP AMR Commission? Can you tell us more about it to start the conversation? Thank you.
So this panel jointly contends that antimicrobial resistance is the silent pandemic with severe consequences on the health, welfare, and well-being of humans, animals, plants, and the environment. A one health issue with unprecedented health, economic, and societal implications. Infections caused by drug-resistant microorganisms result in treatment failure, increase the risk of spread of infections in hospitals and communities, and result in longer durations of illness, higher mortality rates, and increased costs of alternative treatment. AMR compromises major surgery, organ transplantation, treatment of preterm babies, and cancer chemotherapy. It also adversely affects food safety and security and supply chains, and compromises water and soil and other environmental ecologies. The O'Neill and the World Bank report 28 million people living in poverty, and a 7.5% decline in global livestock production. Together with the cost of $1 trillion in additional healthcare costs by 2050, should urgent action not be taken now. So pharmacists have a leading role to play in the prevention, containment, and mitigation of AMR. Over.
Thank you very much for answering the question. I would also like to ask the participants to post the question on the Q&A box as opposed to the chat, and we will be picking them up as we go. Sabiha, we are also now in the middle of the COVID pandemic. So I think people are very interested in hearing your views about how does the COVID-19 pandemic affected the political and public health focus on AMR? Have you seen any changes?
So the clarion call of the COVID-19 pandemic has silenced an already silent pandemic to mute, especially in low and middle income countries. Antimicrobial resistance was very high on the global political agenda and one of the highest public health priorities of the WHO until COVID. COVID-19 has confounded AMR by increasing the selection pressure of extensive and sometimes appropriate antimicrobial and biocide use. We all know that antimicrobial resistance is a function of time and use. The greater the quantities of antimicrobials used and the greater resistance. Every one of the indicators that I mentioned will be worsened by the COVID-19 pandemic, as will be the achievement of the Sustainable Development Goals. The FIP Development Goal of stewardship has been deprioritized as health systems focus on the pandemic response. So the double whammy of AMR and COVID-19 requires unprecedented levels of mobilization and the whole of society engagement for its containment. Over.
Thank you very much. I very much agree with you that the COVID-19 pandemics give us some opportunity to speak more about AMR, as you highlighted as well. But what do you think about the role of the pharmacists? How can pharmacists take the leadership role in addressing AMR? And Sabiha, you were breaking a little bit, so maybe you can disconnect the video for now. Thank you. Over to you.
The video has been disconnected. I'm sorry about that. So who better to answer the question, who better than the pharmacist to take a leadership role in addressing AMR? The pharmacist, as the custodian of medicines, is involved in every stage of antimicrobial discovery and use. The pharmacist is involved in research and development, clinical trials for new and repurposed antimicrobials, the manufacture of active pharmaceutical ingredients and different antimicrobial dosage forms, ensuring quality, safety, and efficacy, the regulation and registration of antimicrobial medicines for use in humans, animals, and agriculture, supply chain management to ensure access and prevent stockouts, the optimal use and stewardship of antimicrobials to ensure recovery from infection, while preventing antimicrobial resistance, and the correct disposal of antimicrobial medicines to prevent environmental contamination. And these are, I tried to sort of trace discovery and development right through to disposal. I think that pharmacists have immense prevention and containment and mitigation of AMR, both individually in our own practice settings and collectively through FIP, through pharmacy associations like FIP, as well as regulatory bodies in policy and practice. And I'm sure that my fellow panelists will explain further on all of these aspects. Thank you, Susanna.
Thank you, Sabiha, very much. That was a very comprehensive answer. And it just highlights that we pharmacists have a big role in reducing AMR and should take the leadership to do this. And we have a lot of pharmacists in the audience, and we have some more questions coming. Thank you very much for that. Sabiha, I would now thank you for now, but we will get back to you again. And now I will give the floor to our next panelist. Next slide, please. Professor Philip Howard. Professor Philip Howard is a consultant pharmacist in antimicrobials at the Leeds Teaching Hospital, NHS Trust, and honorary visiting professor at Leeds University. We are very happy to have you. He is the professor of the British Society of Antimicrobial Chemotherapy. He's also a member of the UK Department of Health Advisory Group on AMR and the NICE Common Infection Guidelines Group. His research interests include antimicrobial stewardship and antibiotic shortages. He led the first global hospital antimicrobial stewardship survey. He has been involved in AMS education and training across the world. He has won many national and international awards. He is a spokesman of the Royal Pharmaceutical Society on Antimicrobials and the Antibiotic Action and British Society of Antimicrobial Chemotherapy Charities. Phil, we are very pleased to have you here today with us.
Thank you. Welcome to be here.
So, given your expertise in the AMR, but also the survey that we were working together on in the past days, we have found out that almost half of the respondents of our survey that we were launching when we had the event on AMR Roadmap, that they were actually unaware of the global action plan about AMR in their countries. And also they were not aware of any actioning objective of this action plan. So what do you think are the barriers? We thought that maybe one of the key barriers was lack of education and robust training modules in local settings. But how can we identify more barriers, and also how can we overcome them? And also given the COVID-19 context that is reducing the face-to-face opportunities, what would be your recommendation on overcoming these barriers? Over to you.
Yeah, thank you very much, Susanna. COVID's been a real sort of challenge for nearly all of us, and I think it stopped probably most of the face-to-face meetings in my country, and I imagine most of the people who are listening at the moment, they've also had sort of big problems with face-to-face meetings. Now, as we've heard already, back in 2018, WHO produced a competency framework for health workers on education and training on AMR, which explicitly includes pharmacists. So it covers awareness of antimicrobial resistance, appropriate use of antibiotics, infection prevention control, and diagnostic stewardship and surveillance. So we know already what needs covering in terms of our education and training. So we just need to get it out to those people who need to know. I think some of the barriers are often financial, time, or language. And we need to ensure that education is ideally free at the point of access in a language that the pharmacists can easily understand and can be accessed at any time convenient to the learner. The younger or technically minded pharmacists will often be glued to their phones, and so learning is a real opportunity when they're actually on the go, sort of using public transport and things like that. So I think there are opportunities such as things like interactive ebooks, which allow learners to access material at work, home, or on the move, and easily have external links. And the British Society of Antimicrobial Chemotherapy has developed a 350-page ebook on antimicrobial stewardship, which anyone can access. We know that initial learning followed by regular refreshers on the job can actually help improve retention. So lectures, webinars, virtual workshops, followed by on-the-job interactions such as clinical rounds discussing cases, prospective audit and feedback, educational outreach sessions can help. But there are also a load of free-to-access courses that are made available. So WHO run them in English, French, and Italian. So there's a few languages there. BSAC, we provide a 3 to 6 week interactive stewardship course in English, Spanish, Portuguese, Russian, Mandarin, and Japanese is coming soon. And so there are lots of elements sort of out there. And there'll be many in other host countries as well, so we just have to get them out to everybody. And for the specialists, we actually offer courses from BSAC on activities from veterinary medicine, so it'll cover the One Health approach, to the really sort of high-end stuff as antifungal stewardship in ICUs and sort of hematology and things like that. But ideally, all of these courses need to use a range of learning techniques. We often call it blended learning, where you can watch videos, read papers, discuss with others on the course. So really trying to get that networking out there. And during these COVID times when we can't be face to face, I think forums out there to get people from around the world to discuss their problems and share their education can certainly help.
Yeah, thank you. That is very interesting to learn about all these tools that are out there and can be used by people, including the ebooks that you mentioned, or the specific training platforms for pharmacists that they can use. That's very helpful. But I just would like to challenge you. Do you think we could have a one-size-fits-all AMR education and training?
No, definitely not. Culture is really important. And in antimicrobial stewardship and in healthcare in general. So education and training, as I said before, needs to be available in a language that pharmacists, technicians understand. But most importantly, it's got to be relative to the country in terms of its own economy, legal restrictions around antibiotic supply, and its culture. So, for example, a Northern European country would be very different from a country in Central Africa, for example. And we've tried to acknowledge this at BSAC, so we've worked with local leaders in other parts of the world to develop relevant courses. For example, there's an online course specifically for Africa developed with the Infection Control Africa Network, and we've worked with other people in Brazil, the Middle East and North Africa on similar things. Other good examples that have been of partnership with high-income countries, working with low-income countries to develop stewardship. And as part of the Commonwealth Pharmacists Association, there have been some 12 highly successful examples of UK hospital teams working in 4 African countries over the last 2 years. And they also have a forum to share sort of ideas. And I think that can be almost a blend of how you can use some of the knowledge from the higher income countries to help sort of bring some of the lower income countries forward, but at the same time, learning the culture and making it sort of applicable on there. The other example out there is there's an e-learning repository that exists on antimicrobial resistance and stewardship from around the world, and it's hosted on a website which is linked to the Journal of Antimicrobial Chemotherapy and Antimicrobial Resistance. And it will actually tell you the country, the setting, whether it's hospital, community. It will tell you what the target audience is, what language it comes in, whether it's free, and the duration of the course. And some of these have actually sort of been peer reviewed out there. So I think there's an awful lot of culturally specific and geographically specific education out there. And so I think there's enough out there that we can almost instantaneously guide people from around the world for something that's culturally relevant.
Yes, very interesting. Also, you mentioned the resources developed by the WHO, and actually we from FIP were also contributing to that. It was the WHO AMR competency framework, and then following that there was the AMR curriculum guide developed, which is basically ready to be used or taken up by the educational institutions or universities. And also thank you for sharing on the chat the link to the resources so that participants can also find them online. But what about the public? How can we educate the public? So you talked about the healthcare professionals, and there are a lot of targeted tools available already, but how can we educate just the general public?
Yeah, because that's the really important part here. It's not just about sort of pharmacy. So the Global Antimicrobial Resistance Action Plan aims to improve the awareness and understanding of antimicrobial resistance within citizens and health staff. So hopefully all countries will read on with this. Now for me, there's 2 scenarios for education of the public. It's at an individual level or at a population level. At a population level, there are plenty of resources available from WHO in many languages. There are also other organisations that provide information. So for example, REACT, which is a Swedish government-funded organisation, have a toolbox on how to set up public campaigns. Within Europe, there is a programme called eBug, And this educates school children about hygiene, infections, and antimicrobial resistance in a fun way as part of the school curriculum. And these children will also educate their parents. So if we educate the young, they'll educate their parents, but they will also have that knowledge as they sort of grow up. In some countries, there are actually antimicrobial resistant badges from the Scouting or the Girl Guide associations out there, which help also get children coming in. And one of the bits of work that the Wellcome Foundation has done recently is a report on the best way to communicate AMR messages with the public. And what they've said is it's not about telling the public that there will be 10 million deaths a year in the year 2050 from antimicrobial resistance, but actually focusing on the here and now. So how does antimicrobial affect the individual and their family and in the locality in which they sort of live in? How does it affect specific infections such as urinary tract infections or gonorrhea, which are difficult to treat? And so in my city, in Leeds, we've targeted that approach, and we have a website called Seriously Resistant, which will show you some of the local examples that we've developed in Leeds. Then at an individual level, the use of printed information to reinforce spoken information from the pharmacist is particularly sort of useful. Patients will often keep these material for next time they get an infection. And in the UK, we've developed these for respiratory and urinary tract infections, and also some for children. And we've made them available in 24 different languages, and there are pictorial versions. But it's not just that. There are other really good examples around the world from GRIPT, REACT, have others, and many other countries. But one of the bits I really want to sort of highlight is something about getting the individual to take personal responsibility for their actions, which can help. So campaigns like Antibiotic Guardian is available in many countries around the world and in many languages. And this gets individuals to sign up to make a pledge to become an antibiotic guardian and look after the antibiotics we've got. So I think there's plenty of resources available to educate the citizens of the world. And my personal view is that pharmacists should be actively promoting infection prevention through vaccination and hygiene and responsible active antibiotic use, and especially around World Antibiotic Awareness Week, which is always around the 18th of November each year. So lots to do, plenty to get on with.
Yes, lots to do, and it's coming up quite soon, given that, as Catherine mentioned, it will be October soon. Yeah, and also thank you for bringing that point of the tools being fun for people to use, like the e-book for children, but also focusing on what the current impact is. So creating some sort of sense of urgency and involving people to act responsibly, and also thinking what they can personally do to improve the situation. Thank you, Phil. I will now give the floor to our next panelist. Next slide, please. Professor Deborah Goff. Professor Debbie Goff, hello, is an infectious diseases specialist at the Ohio State University, Wexner Medical Center, and professor of pharmacy in the College of Pharmacy. She serves in the Ohio State University One Health Antibiotic Stewardship Committee, and she is the 2019 recipient of the Ohio State University Distinguished International Outreach and Engagement Award for her work in South Africa. Her patient outcome research and publications on antimicrobial resistance superbugs has made her one of the global faces of antibiotic stewardship. Her fearless approach and her nothing is impossible attitude allows her to help hospitals implement stewardship teams in the US, but also around the world. And she started an international train-the-trainer antibiotic stewardship mentoring program for South African pharmacists that includes bilateral visits, development of patient research, and paying it forward approach, which allows the mentees to transfer skills to other colleagues. She is also one of the 25 global experts selected by the WHO to implement antimicrobial stewardship in low, middle-income countries, and she serves on the advisory board of the Combating Antibiotic Resistance Bacteria Biopharmaceutical Accelerator. Debbie, welcome. It's a pleasure to have you here with us today.
Thank you.
So as the expert, as the real expert on the antibiotic stewardship in hospitals, can you tell us more about the hospital pharmacy and how can hospital pharmacists contribute to the antibiotic stewardship?
Sure. Well, I've had the great opportunity to work with hospital pharmacists across 6 continents, but most of my work has been in South Africa, helping to implement antibiotic stewardship with non-infectious disease trained pharmacists, which is representative of many of the pharmacists in low middle income countries. And many people ask, well, how can you do that if there's not infectious disease training? And it's actually quite simple. There are so many ways for pharmacists to be involved in antibiotic stewardship. And when we started our work in South Africa, the pharmacists that were able to be up on the wards and making some ward rounds, whether that be replacing stock or actually working with the physician teams, we started with very basic interventions such as IV to oral switch. When a physician would order multiple antibiotics, just simply asking them, did they want to get cultures ordered? When the cultures would come back, teaching the pharmacist how to do bug-drug matching or mismatching and changing antibiotic therapy, or the power of suggestion when a patient's on antibiotics for 7 days, simply asking the physician, your patient's been on these for 7 days, did you want to stop them? Because in many of the low middle income countries with paper charts, it is very hard to figure out how many days the patient has actually been receiving antibiotics. And that is a role a pharmacist can play and just remind the physician, and it's incredibly valuable. And so that's really where we started. But what I think was so important, when you start stewardship as a pharmacist, whatever intervention you're doing, you must document the impact of your intervention. Otherwise, no one will actually really appreciate what it is you're doing. So in collaboration with ourselves at Ohio State, we designed this as a study. And we're very proud to have it published in Lancet Infectious Diseases, which really gave us the opportunity then to teach the world how we implemented stewardship with non-ID trained pharmacists who really spread this across 47 hospitals in South Africa. Other ways, if you're a dispensing pharmacist, you know, when you go to do ward stock replacement, you can simply look at, are the antibiotics you delivered yesterday still sitting there? You know, physicians think when they order an antibiotic, it's magically given all the time. And we as pharmacists and our colleague nurses know things happen. Patients go down to get an x-ray, they're not available, they miss the dose. You're prescribing an antibiotic given every 6 hours and there's no nurses to administer them because they're so overworked with patient volume, and the antibiotics get missed. Just identifying that is an antibiotic stewardship initiative. So if the ceftriaxone from yesterday is still sitting there, that's a 24-hour day missed opportunity of antibiotics, and the physician needs to know that. That is stewardship, and every pharmacist, no matter what country you're in, no matter what your resources are, can contribute to that.
Thank you. Thank you for this very comprehensive answer, and it's also very inspiring to hear about the work that you have done in antimicrobial stewardship. We have a lot of questions coming in, and one was about the COVID-19 actually. Can you tell us more about, in your opinion, how it impacted
Yes.
the stewardship? But also, we had a question from a participant asking whether we will take into account the COVID-19 context into the roadmap and the work of the commissions, for example. The participant said that it looks like COVID-19 is shedding the light on the role of prevention and vaccination and the role that pharmacy-based immunization could play as well. So could you touch base on that, Debbie?
Yes. Let's see, how much time do I have? So COVID has just turned our world upside down, but there are some good things that are going to come out of COVID, and the awareness of antibiotic resistance the overuse of antibiotics, and the role of a pharmacist are, I think, opportunities we have to absolutely jump on right now. So yes, it will be integrated into our roadmap. But early on, as COVID evolved, in the first month, antibiotic stewardship guidelines, policies flew right out the window. We gave antibiotics to everybody, and I really can't fault people. When we were seeing patients and you want to do something, and that something was give them antibiotics because there was nothing else to do. We had no idea how to approach these patients. And these patients went from presenting on room air to being intubated literally within hours. And it was quite traumatic, actually, and it still is. But now we have so much more data. So what have we learned several months into the management of COVID patients? Well, there have been really some great studies about the impact of antibiotic prescribing on COVID patients. One most recently in the United States came out of the state of Michigan, 38 hospitals, 1,700 COVID patients, up to 84% received antibiotics on admission. How many do you think actually had a co-infection with a bacterial isolate? 3.5%. Our colleagues in the UK, Mark Gilchrist, one of our pharmacists there, is a co-author on a UK study that showed very early on, they looked at all the data being published on COVID and found very similar results. 72% got antibiotics, but only 8% had a co-infection. So now we know that most patients do not have co-infections with bacterial organisms. So we also have a strategy now on how to manage a COVID patient. We're not in panic mode. We're developing guidelines. So the rational use of antibiotics and the role of a pharmacist in managing antibiotics on COVID patients can really be at the de-escalation point. Once you confirm this patient has COVID, and remember early on, those results were taking 1 to 2 weeks to get back. Now we can get them in an hour to within a day. So once you've confirmed COVID, then there's comfort in knowing, okay, we absolutely know this is COVID. If you have a respiratory panel to rule out bacterial isolates, you can then de-escalate or stop your antibiotics. If you use procalcitonin, there's a great study showing how you can correlate that to the continuation or discontinuation of antibiotics. So stewardship programs now can get back in and do stewardship. It's absolutely essential in our hospitals, but early on, it was total chaos. And I think we have learned a lot. And now we can get back on focus of de-escalating, stopping antibiotics, or actually not even starting them if you have a rapid diagnostic test.
Yeah, absolutely. Thank you for highlighting these changes that have been that we have been witnessing as well. We also have a comment from one of our participants saying that the documenting the impact that you are highlighting, it's really crucial, and that they are looking forward to the ways of developing the stewardship indicators in participatory approach with the pharmacists and other healthcare professionals. So a lot of positive feedback already. Thank you. Just very quickly, can you just in a few sentences touch base what the community pharmacists can do in the antibiotic stewardship goal?
Sure. So community pharmacists have a huge role. Most of the efforts have been focused in the inpatient hospital setting, which is where I work. But now I am working in the outpatient arena, because I think when we look at COVID, one of the positive things that's coming out of COVID is we're doing telehealth. You know, patients don't want to come in and see their doctor because they're afraid of acquiring COVID, but we're doing telehealth, but that's a little bit scary for pharmacists in the outpatient setting, because we know from previous studies before COVID, antibiotic prescribing is actually higher with telehealth because the physician actually isn't examining the patient. So our colleagues in the community have a huge role here as we move forward. There has not been any studies yet. I'm sure someone's looking at it, at the impact of COVID and outpatient prescribing of antibiotics. My suspicion is it's higher. So we really have to count on our colleagues in the outpatient setting to monitor the use of antibiotics and educating patients. As Philip stated earlier, that is really the key. We know patients pressure physicians to get antibiotics because they think they're safe. And we actually know that that's not the case. Diana Shura-Ordup with Public Health England and the Commonwealth Program has done a phenomenal job educating patients and so many tools available for community pharmacists to use. And then Eduardo is going to talk about the significant role of vaccination with pharmacists. So I'll stop at that point.
Thank you very much, Debbie. We will get back to you later, but now I would like to introduce our last but not least panelist, Professor Eduardo Savio. Welcome, Eduardo. He has served as the chair of the FIP Policy Committee on Antimicrobial Resistance in 2018. That was the committee that wrote the statement on AMR of FIP. He has also served in FIP in different capacities, for example, as the vice president at the FIP Bureau. Now he is the president of the Pharmaceutical Forum of the Americas, and he's leading the work being done in this region and the role of pharmacies can play in addressing AMR. He has been very internationally active with more than 150 presentations in international conferences. He's also the head of nuclear pharmacy research and development at the Uruguayan Center of Molecular Imaging, and he's also a member of the directive board of this institution. Welcome, Eduardo. It's a pleasure to have you. And I would just like to ask you first, because you are the president of the Pharmaceutical Forum of the Americas, would you like to tell us something more about how can we work with the forum and with the members on the regional work around the AMR?
Yes, good morning, Susanna. Thank you very much for your nice presentation. And I'm very happy to be here today. This is a very important event, the launching of the AMR Commission. We have a plan, we have a collaboration and partnership with FIP, and so we have a very important perspective. And in this time, your question for me is very important. Last week, we have been participating along Wednesday and Thursday of different activity with each regional WHO regions. And in this activity, finally, we have arrived to the feedback of hundreds of colleagues to different proposals. These proposals are aligned with the global AMR action plan, but the important thing is that they are customized to the needs and the priorities of each specific regions. With the forum, we have a very nice and unique opportunity to establish working group and to work with this proposal that has been discussed along last week. And it's a very important starting point. And the Commission can have this working group in each specific region in order to move forward to the global plan that we have for next year.
Mm-hmm. Thank you. That's very exciting to hear, and also it's very exciting for us in FIP to see that there is so much to do and we have so much work ahead with the Commission to achieve all these objectives, and also the FIP Development Goal on antimicrobial stewardship. Eduardo, we have been talking briefly about the infection prevention strategies and also the role of vaccination. What can you tell me about other prevention strategies and also the infection prevention and control related to the water, sanitation, and hygiene? How can pharmacists contribute to this one?
Okay, thank you, Susan. These are two important issues that you have addressed today. You know, everybody who is participating today, we are aware that vaccination throughout life is a cornerstone of public health and one of the most effective methods of preventing the spread of infectious disease. We also know that in the recent years, the number of countries that have introduced vaccination by pharmacists or the community pharmacies has increased. But however, there are many barriers, and we are aware of opposition to these expansions of pharmacists' scope of practice in many countries. Luckily, this year, FIP has published a very important guide. This is a gold standard guide that is called, the title is Give It a Shot, Expanding Immunization for Pharmacists. And this could help everyone to drive the expansion of coverage rates. We know that infection prevention through vaccination is routinely undertaken in almost all the countries, and often we are always worried with people that are a high-risk group and they have not received common vaccines like influenza, for example. The rates could be between 15 or 30% in high-risk population group. We also know that there is an inappropriate use of antibiotic in viral infection. So there is a lot of place for us to work, because pharmacy is usually the first place where patients go to for advice. And the key role of pharmacy in public health has been addressed by WHO and FIP through good pharmacy practice guidelines in 2011 in India. And FIP has advocated for this role to WHO and other stakeholders. And so, besides improving the infection prevention and control and water sanitation and hygiene, we have a key role in counseling patients and how to take and dispose unwanted antibiotics properly that can increase adherence and reduce the inappropriate use or environmental contamination. So we have a scope of different issues where we have to move forward.
Yes, thank you, Eduardo. That's very true. So you also touch base on the environmental issues, but also about the different activities that actually contribute to reducing AMR that are very important, like the vaccination one, for example. I would like now, because we have a little bit more than 10 minutes left, I would like to invite all panelists now to answer the questions that we have received through the Q&A box. I have seen that many questions have been answered in the written way already. But we still have some that we would like to address live. There was one about the environmental impact of antimicrobial agents or antibiotics. Is this going to be anyhow addressed by the Commission? And if yes, what can we do in this regard? Who would like to answer? Phil?
Yeah, I'm happy to take that. So, so I think this is a really important element. We focus an awful lot on human health, and we seem to forget that probably the majority of antibiotics used globally are actually in animal food production. So one of the things that I'm really keen on is that we talk about this antibiotic footprint, and that we look at a national level what our antibiotic consumption is. But part of that we have to look very carefully is that whenever you give a human or an animal an antibiotic, it passes through them, and it either goes into the sewage system, if it's actually in a hospital or in patients' homes, or in a farm, it will actually sort of go into sometimes the local waterways. There is a lot of research being done globally at the moment, looking specifically on the impact of giving antibiotics routinely in farm animals. I know there's lots of work being funded in Argentina around this. And I think because we're taking a One Health approach from practice through to research on here, I think this is a really important area. And interestingly, I only had a conversation 2 days ago about this very subject, about looking to what we could do locally in southwest England. So I think it would fit neatly into some of the research that we're considering exploring.
Absolutely. It fits very, very well, as you said. There was also a question that was on a different topic, but it was about how can pharmacists communicate better with the doctors? How can the two professions collaborate in a more effective way around the antimicrobial resistance?
Well, I'll be happy to take that question.
Go ahead.
My recommendation is what we call in the United States handshake stewardship. The physician needs to know you in order to trust you. And, you know, calling someone over the phone who does not actually know you is sort of analogous to those solicitor phone calls you get when you're sitting down for dinner and they're trying to sell you something and you just hang up on them. And you really have to develop that relationship. And you know what? They will welcome it. Anybody prescribing antibiotics, they are doing that because of their belief that it's helping their patient. But we have learned so much about the harm from antibiotics and how many studies globally have taught us 30% of antibiotics are actually unnecessary. So there's a lot of work ahead. And we as professionals, the pharmacists, have to step up and be the ones to be the voice to question the antibiotics. So don't hesitate to introduce yourself to the physician and state that I'm going to be evaluating antibiotics and I welcome working with you. You know, they're very nice people. They want to take care of their patient the very best. So don't be afraid to actually go and introduce yourself to the physician to work with them. It will work.
And to Philip here, and I also think this is really important in primary care as well. So certainly some countries have it built into their national guidelines to make sure the community pharmacist is actually part of that antimicrobial stewardship team within primary care. And I think one of the ways to do it is actually for the local community pharmacist to actually make sure they can have the opportunity to go along, have a conversation with their local family doctors, and explain some of the benefits that they can actually provide. I think family doctors will welcome the role of the community pharmacist because what they do is take pressure off people wanting to see the doctor urgently for infections. And most of these infections won't need an antibiotic. They can actually be normal self-care medicines will suffice. And that opportunity the community pharmacy has is one of education that hopefully the patient will then learn for the next time and take pressure off the family doctor. So I think there's real opportunities in both hospital and in the community.
Absolutely. Thank you, Phil, and also Debbie for the informative answer. And there is a lot of opportunities to collaborate with the other professions, not only with doctors, but also with nurses and other healthcare professionals around the reduction of AMR. We had another question from another participant talking about the AMR group or AMR Commission. Are we going to use the work of the Commission to stimulate the communication channel around the collaborative researchers? So in terms of stimulating the scientific aspect of antimicrobial stewardship, is the Commission planning any work around that?
So Susanna, I'll take that. Just to say that one of the key roles of the Commission will be to develop a research agenda for AMR and to do a research prioritization, list as well. So first of all, we'll gather all of the types of pharmacy-related research that is required in AMR. We'll prioritize this and then try to gather funding, etc., to roll it out. And I want to say to the person that asked that question, collaboration is key. AMR doesn't have any borders, and neither should we as researchers. While I have the floor, Susanna, there was one question around the use of the digital technologies in addressing AMR and stewardship. And Debbie rightly mentioned that we can see that when it's telehealth related, there seems to be an escalation of antimicrobial prescribing. But the creation of simple apps with treatment guidelines. So in Malawi, they created a little app that allowed the person to use, the doctors and the clinicians to use their smartphones to look, okay, this person seems to have a urinary tract infection or a hospital-acquired infection or a ventilator-associated pneumonia. What does our algorithm and our treatment guidelines say? So it was simple things like guideline compliance that was advanced by that. In South Africa, we use a simple app to register the barcode on a lab test. And that barcode then was then accessible to the clinician to look into whether the patient actually did have an infection. Also accessible by the pharmacist to see whether the correct antibiotic was indeed prescribed. So there was sort of this simple barcode that allowed access to pharmacists, to clinicians, as well as to research. We're trying to correlate whether there was an infected microbial was prescribed. So the technologies can be used for good as well as can be used for good as well. Thank you. Sorry about the connection.
No worries, and thank you for the comprehensive answer. And of course, the use of technologies, it's something that we need to look into as well in terms of how can this be used for antimicrobial stewardship or antimicrobial resistance fight. There are already apps available for healthcare professionals to use to look into behavior change, for example. Okay, we have time for just one last question, and that will be going to Eduardo. Eduardo, you were chairing the policy committee on the statement on antimicrobial resistance of FIP. How can we, what would be the best strategies to implement the recommendations from the statement, in your opinion? Thank you.
Yes, I think yes, it's always a huge challenge in terms to come from what is written in the guidelines, is that we know what to do. And then when we come to the implementation field and how to do it. And I think that the opportunity is for the commissions is that to have the arms, the brain, and the legs of all the colleagues in the world that are willing to help us to come our guidelines into reality. So I know that we are going to transform pharmacy and the contribution of pharmacy in AMR. So giving specific strategies and working aligned with the plans. This is the great opportunity that we have in terms of implementation, what we have written 2 years ago. We have done a lot of things in these 2 years. This is a cornerstone today in creating the AMR commissions that will articulate all the efforts globally to work with the same strategy. Thank you very much for this question, Susanna.
Yeah, thank you very much to Eduardo, but also to all our panelists. Next slide, please. Because we are approaching the end of this webinar, I would just like to quickly wrap up this informative session. We have been talking about the fight against antimicrobial resistance, and we have today officially launched the Commission on Antimicrobial Resistance of FIP. So we have an ambitious goal ahead to further develop what pharmacy has to offer in AMR fight, but also to further explore the opportunities to increase the impact of pharmacy in all settings and scope of practice in antimicrobial resistance. So we are looking forward to the work ahead to drive the new FIP AMR roadmap and also to guide the action globally, sustaining the momentum, but also to tracking the progress and evaluating the progress, where do we stand, and really driving this global health priority further. So we are also looking forward to the implementations of the specific goal on AMR, the goal number 17, together with the pharmacists, pharmaceutical scientists, and also pharmaceutical educators in reducing AMR. And with this, I would like to sincerely thank our panelists today, to Debbie, Eduardo, Sabiha, and Phil, but also to Dr. Dagan, FIP CEO, for all the insights and all the presentations that you had today. The recording of this episode will be made available, and please give us your feedback via webinars fip.org so that we can continue improve our digital events in the future. Thank you very much also to the audience for all your questions and all your comments. Many of them we were able to answer through the Q&A box, but also live. So thank you very much for your attention, and we are looking forward to the work ahead. Goodbye.